It's your eye health experts, Prevent Blindness Texas, and welcome to Eyespiring, a conversation about all things vision and life.
Hi, and welcome to this episode of Eyespiring. I'm Heather Patrick, the CEO, and your host for today. This episode is a little bit different in the sense that Monica and I are going to spend some time talking about our year and what's ahead for PBT2 as we move into 26. So, with that, all of you probably know Monica Guerrero. She's my VP of programs. But if you haven't met her on the previous episode, Monica, how about if you introduce yourself?
Hi, everyone. I'm Monica Guerrero. I'm the VP of Programs and Community Outreach for PBT and happy to be here.
All right. So, if you've been listening along, we have you know that PBT is agency focused on vision and delivering vision care and eye health across the state. And so we're going to talk about what the years look like and some of the great wins we've had, some of the challenges, and then how we're moving forward. So, with that, Monica, why don't you share some of our success stories from our clients that we've worked with over this past year?
Great. And I just want to start off by saying we receive hundreds of success stories, so we just kind of pulled out a couple. But we do want to share a few from our adult clients and also from one of our students that received services from our PBT programs this past year. So I'll start off by sharing the story of Elizabeth. And she wrote us and she said, Prevent Blindness program was a blessing for me. Being able to get assistance for my eye exam and glasses without vision insurance is wonderful. I am a student at the moment, and my last eye exam was 2 years ago, which I knew was time for an eye exam. Even wearing my glasses, you know when your vision has changed. Thank you for assisting people in need with their vision care. We're happy
Awesome.
Elizabeth was able to get her glasses and also continue with her studies. And then we also received another story from a client whose name is Melissa. And she says, thank you so much for providing me with prescription glasses. I have been working to get my life in order, and getting new glasses was a huge help. I can now do so much more since I can see up close and at a distance. Thank you so much. So Melissa was another grateful client that whose story we were able to just share. And then we also received a success story for a child client, and this was from one of our partners. And she was really excited to share with Maribel, who's our program coordinator. And she says, good morning, Maribel. Thank you so much, with a ton of exclamation points. Madison got her glasses as of today. She declared, I can see. She is skipping everywhere, and she shared that she even got a free spray to keep her purple glasses clean. Thank you for helping this wonderful student. This was the missing link for her to do better in class. Thank you so much. So this is a great example of how we not only help our adult clients, but also children to be able to see more clearly and not just be able to see, but also do better in school. And of course, for our adult clients who always rave about being able to just do better in life. So that's just a little bit about what PBT does for our clients every day.
And it really comes to our why, right? When we get those stories, it anchors us in our why this work matters so much, how important it really is, and that we talk about changing lives every day, but we really are the team is out there delivering services that makes a difference to thousands of people every day. All right, so let's talk a little bit about kind of what that has looked like over the last 9 months for us and going into Q4. So for us, our fiscal year runs April 1st to March 31st. So we're about a quarter off from the regular calendar year. But talk about what this last year has really looked like in terms of for your team, both big successes and then, looking ahead, the work that lies ahead.
Yeah, well, I just want to start off by sharing that last year we screened over 61,000 individuals, and that includes both adults and children. We also increased the number of individuals that we educated, and we educated almost 130,000 individuals on eye health and safety messaging. This includes both for children and adult eye health and safety topics. We also trained and certified more than 930 community volunteers to help us conduct certified screenings in the community. That could include children and or adult screenings, and also to deliver eye health education. So that's also a huge part about what we do. It's not just about screening, but also educating the community about keeping their vision healthy and also helping to deliver the message of the connection between vision and overall health. And then we also provided financial resources for over 9,200 individuals. And this includes resources for comprehensive eye exams and or eyeglasses. And these are, some of the stories that we just read is a result of some of those resources that we gave out. And the demand continues to increase every year. We do this with a small team of 9 and a ton of volunteers who help us to deliver our messaging and really help us to move our mission forward. And that's, we're just hitting a little bit of what we know we can do, and every year we're doing more. And so our goal is always to help increase the number of volunteers that we have in the community who can help us increase this messaging and the screenings that we do and the resources that we give out. And then also to ensure that our clients are receiving the follow-up care. So for us, it's not, just about giving the resources, but also ensuring that the clients that we're delivering these resources and messaging to are actually following up with the care that they need. And that's a huge part of what we do. It's care coordination. Our staff spends a lot of time ensuring that our clients are provided the necessary steps to be able to make sure they understand what they have to do. And then also be able to see. I mean, ultimately, that's our goal, is for them to be able to see clearly.
And when you hear that number, 61,000 people, what resonates with you? What is that like? What in your mind? What does it mean to you?
That we still have room to do more. Texas is such a huge state, and I know we're hitting a tiny particle of what I know we have the capacity to be able to deliver, and so that we have a lot of work to do.
Yeah. I think about, even right before COVID, we were hovering right around that number between 12 and 15,000, right? And now we're serving 60,000 people. It is, when you take a step back, and it is amazing. It truly is incredible to be able to increase the amount of people we serve. But you're right. We know that there's so much more work to be done. And so that's our first call to action. So for our audience, we are always looking for volunteers to serve in so many capacities for us, right? To go be a screener, to be a health ambassador, to go out into the community and talk about the education component of vision health, right? To serve on our event committees, to be on our board and board committees. So if you're interested at all to get involved in our organization, now is a great time to reach out, because we are always looking for volunteers. So talk a little bit about financial resources, right? That has grown significantly too, the number of individuals we've provided financial resources to. When you hear that number, do a quick calculation for me. Just say 9,000 at $100, right? We know that it's more than that, but that's, if you take 9,000 times 100, right? That is the amount of, that's the value of what's being reinvested, right? Basically, into the community on our behalf, right? To serve clients. What does that mean to you?
It gets me excited. I mean, I know, kind of going back to the conversation of screening, and I know you just mentioned, before COVID, how we were doing so much less, but I've seen us grow every year. And so it's so exciting to see, especially how we're going into strategic planning in the next 3 years, how much more we're going to be able to do in the next 3 years. And, with more screenings comes more resources that we deliver because we find more people, that need more help. And I think that's something that we're finding, especially in kids. We're getting a huge increase in, the number of kids who are applying, whether it's a parent, whether it's a school nurse, whether it's the school partner who's applying on behalf of a student. We're seeing an increase in kids, needing resources. So um, it does get me excited. I think about next year and I'm like, is it going to be 11,000? Is it going to be 12,000?
No.
Because even last year, when you think about us doing, or the year before, us giving out 7,500, resources and then jumping to 9,200, for me, it makes me happy to see that 9,200 people are getting the services that maybe they would not have, or they would not have received if it wasn't for services like Prevent Blindness or programs like Prevent Blindness.
I mean, I think that is right. That to me is one of the key takeaways. We know 9,200 people would not have gotten the care they needed without us. They wouldn't be able to see without the care they received from us. And I think that is a testament to the work that we are doing, and our commitment to serving the community. So when you think about, upcoming, even the last quarter for us, but then moving into 2026, what excites you the most?
I would say the education piece. There's a huge thirst for education,
Mhm.
especially the last couple of months. We've had a lot of great conversations with some of our partners who have really requested education on diabetes and vision. And, diabetes is always a topic for me that I think it's so weird that they talk about nutrition, they talk about diet, they talk about exercise, they talk about checking your levels, but they don't talk about vision.
Yeah.
And so I think a lot of partners are starting to realize that. So whenever we're out in the community and we're talking about it, it's like a light bulb goes off and they're like, wait a minute, we're not talking about vision, and we should be talking about vision because that's something that's severely affected when
Yeah.
a person has diabetes. And so, the amount of, educational presentations that we're being asked to do for 2026. I mean, the year hasn't even ended yet, and I'm already excited about going into
Yeah.
January and February. But, as we continue to plan out, especially with our fiscal year coming up in April 1st, it's exciting to know that we already have, so many requests and we haven't even started the fiscal year.
Mhm.
And so
Mhm.
it's exciting. And I know our national office is also doing some updates to our programs, which I think are going to be really exciting, more interactive.
Mhm.
There's some great videos that we'll be able to share to really hit home to the community that we're delivering the message to about the importance of, vision and diabetes and just taking care of their health.
And talk a little bit about World Sight Day. So we did a number of events leading up to World Sight Day. So talk a little bit about how your team approached that.
Yeah, so last several years we've participated in World Sight Day, and what we do is we schedule events around promoting this event. So we schedule events all the time, but it's specifically promoting the message of World Sight Day. This past year, we screened almost 1,600 individuals, and that includes both children and adults. And we did this at various different community settings. A lot of it really was focused on kids,
Mhm.
because a lot of our focus in September and October is on children's screenings. But we also did screening events at community, colleges. We did screening events at local health fairs, local community events, community clinics, community health centers, anywhere where we knew we could spread the message about that we're not just promoting the message of, the vision and the importance of vision just here in Texas, but it really is an international
Yeah.
messaging, and we're part of a larger collaborative.
Yeah.
And so that was exciting for us to be able to promote that.
Yeah. Part of the global community,
Right.
right? That is trying to deliver innovative solutions so people can keep their vision. So World Sight Day was October 9th, right? And it's usually the second Thursday,
Thursday. Yeah.
right, in October. All right, awesome. All right, so let's talk a little bit about how we get to do these things, right? And no money, no mission. And so we've had a couple of great events, and these events really are the lifeline for us to be able to deliver our services. So in May, we had Tee Off to Prevent Blindness, which is our annual golf event. It takes place in the DFW area. And for the second year in a row, we had a hole in one. So that was really cool. Nate Rump got his hole in one this year. It was John McMahon last year. So that was super exciting. And then we also had the TED Patient and Caregiver Forum, which we were part of in partnership with Vision Health Advocacy Coalition. That event was sponsored by Amagen. And shared our very own Dr. Layla Lohman and her story about thyroid eye disease and having that conversation. And so that was a great event too, and something that we would like to do more of. I think to your point, moving forward, right, that education component all the way around for providers, for patients, for the general public, I think is key to really help people understand. And we talk about it all the time. It's not just about glasses, right? Although that is a large majority of what people need. But there's just so much more. It's just so complex. Your eyes really are the windows to your soul and to your health. And so really events like this, I think, give especially patients the opportunity to really come in and ask questions and learn more. So it was exciting to be a part of that. And then, we launched our podcast. That was super exciting. And so it has been amazing to be a part of this journey. And really a big thank you to Wendy Ballard, who does all the technical components of making this podcast go. And we won't be able to do it without her. And so, but I think just for the team, it's been really exciting to get the feedback and know people are listening and learning. And so, we're excited to keep doing it. And we have some really great people lined up for 2026. So, if you've enjoyed the podcast, get ready because we've got even more people coming and really talking about what the future of health looks like and leadership and even the sector. Because certainly this past year has provided some opportunities and challenges in this sector, but super excited about the continuation of this podcast and all the conversations we've had so far. We also had a pretty exciting year. So talk a little bit about Celine's award. And of course, we had Mike Vitale, and he actually had 2 awards. Mike is on our board. And he was recognized twice this past year. So that was exciting. So talk a little bit about Celine too.
Yeah, so Celine is a volunteer who's been volunteering with us for about 2.5 years. And she started off as a vision screener. And then we started working with her to provide screenings at a homeless clinic. And then now we're also working with her group, who's also become certified to do vision screenings at one of the community clinics in the DFW area. But she is a medical student at the University of Texas Southwestern Medical Center. She's class of 2027. But we had the opportunity to nominate her for the American Public Health Association 2025 Vision Care Section Distinguished Student Service Award, and she won. And so that was really exciting. It was exciting for Celine, but it was also exciting for us, for her to be able to represent Prevent Blindness Texas as a volunteer. She went in November to receive her award. And then also was able to meet some of our national staff while she was there, who also attended the presentation. She was super excited, sending some really great photos that we were able to repost. And it's nice to see a volunteer who came to us with this vision of just providing vision screenings and resources, and how her role as a volunteer has expanded over the last couple of years. But for her to be so invested in our mission, I think it really speaks volumes of how we've been working with her as a staff. And hopefully after she graduates medical school, she continues to help prevent blindness. But, ultimately that's our goal, is for, once our volunteers finish school, that they continue to be engaged, because that's something that we would like for them to do in whatever capacity they can give. But we're hoping that, Prevent Blindness always gives a long-lasting impression of the services that we were able to provide, and how we were able to work together to make that happen. And I think for us, that's always the goal, is to work together with our volunteers, to move our mission forward.
Collaboration, right? It's one of our key values. So, and of course, it was fun to be recognized as one of the most admired CEOs. I'm not gonna lie, that was pretty cool. And I had the opportunity to have Monica and Craig there, and that was amazing. It was just so cool to sit in that room with just all the different leaders of this city. Just hear some really amazing stories, and some great advice, right, about spirit animals and what you tell your younger self. So I thought that was great. But overall, it was a fun day. It was a great day, and a really cool moment. And then we moved into Eye Stroll, which was our 15th Eye Stroll for Vision. And it's been at the zoo all 15 years. And so that it's a great partnership. There were lots of people there this year. It was a gorgeous day. And we had a lot of individual fundraising for that event. So that's exciting to see that people are embracing that element, the peer-to-peer fundraising component, which is really important for us. So your team was there, you were there, your family was there. So it was a great day.
Yeah, I told Heather, the weather was really nice, but the thing about the Eye Stroll going on for 15 years is that it's happened every year, rain or shine.
Mm-hmm.
We've had years where it's rained really bad. We've had years where it's really cold. And then I would say a large majority of our years have been really nice weather. But just to know that regardless, whether it's raining, whether it's cold, whether it's hot,
Whether it's COVID,
whether it's COVID, our
people still
supporters
show
are
up.
there to show up and support our mission.
Yeah. Yeah. Agreed. Agreed. And then we also launched our first DIY for Sight event, and that was the Delta Gammas at the University of Texas did a pickleball event for us. So thank you to them. But a great example of, you don't have to wait for one of our events. If you want to fundraise on our behalf, we have a platform to be able to do that. And so, reach out to us. We can help you get it started. But a great example of what a group can do. They raise a couple $1,000s for us. And so that's super exciting. So thank you to DG. And then, of course, we have Q4 coming up for us. And that is when dark dining happens. And so this is an event we've been doing. I don't know, this is what, our 7th one, 8th one. They all go by so fast. This year we have Christine Ha as our keynote speaker, so we are super excited about that. But it's just our signature event that one highlights those individuals that are trailblazers in the space, and also key people for the organization in terms of the volunteer of the year, corporate partner of the year, the philanthropist of the year for PBT. And so it really is our time to recognize and thank those that are in this space that are helping PBT and all of the industry really move forward. And it's such a great event. It's super exciting, lots of fun. This year it's a Mardi Gras theme. And so we really look forward to that event and recognizing those individuals that are a part of that event. Monica, you've been there every year too. So it's just a really nice, it's just a really good, like that night you leave feeling like this is really awesome.
Yeah, and I think also being able to share not just, the stories of some of our clients, but the perspective of our partners who are involved with Prevent Blindness, and Just seeing how excited they are to just show up and tell the story about, how they got involved with PBT and, some of the stuff that they've done. And then to see them want to get others involved is also really exciting.
Yeah, agreed. Agreed. So, again, there is plenty of time to get tickets. Get yours now. You can obviously buy a table. You can be a sponsor, but you don't want to miss this night, and particularly for this upcoming year. And I know it's going to be a fantastic evening. And then we close out the year March 31st. And so we are working on a new strategic plan. And so we'll end on that note of what the future looks like. So you've been a part of this process, Monica. As you think about the next 3 years, what stands out to you of where we're going?
Yeah, I think, for us, a huge focus on children. I know there's been a lot of research about, the increase of myopia in children, and a lot of our school partners are really starting to see that a little bit more as everybody pretty much has returned back to their normal post-COVID. But they're also starting to see the increase in children who are failing a vision screening, who are needing resources, but also, the need for parents to be able to better understand, why is it important to take your child to an eye exam if they've been identified as having a potential vision problem. I see there's just such a big push and such a craving to want to partner with PBT about helping make that message happen. And then also a lot of conversations on how vision loss can affect mental health. That's another topic that we've had a lot of our partners reach out to us about. And then, just there's so much demand for adults who always need resources. But I think for us, it's not just about increasing the number of people that we serve or the number of people that we screen, but it's really about increasing the number of people who are actually accessing the follow-up care that we are recommending, and making sure that they're following the next steps, after receiving a vision screening and actually getting the eye exam, actually getting the eyeglasses, and adopting new behaviors of, what does it mean to take care of your vision? And, do they understand? And how can we help you better understand? And so I think as, we move into or almost moving into our new fiscal year, that those are some things that are really important to us. And just really, having the topic of vision stand out. We think about everything else that's involved with medical, but we never think about vision. Vision and dental are always pushed to the side. And we want to make sure that vision is a part of that overall conversation. We want to be a part of the medical conversation, and we want to make sure that anybody who's in the medical field understands that vision is just as important as diabetes, as blood pressure, as heart, as anything else that's involved with your health. So for us, that's our goal. Our goal is to make sure that vision stands out just as much as everything else does.
Yeah, yeah, I agree. That was a great way to put it. So for us, like Monica said, we are wrapping up our strategic plan. We will move into the new one April 1st. Again, all different ways to get involved and help us move that plan forward, move our mission forward. One more exciting thing that's happening for us is we are doing a large scale campaign for our year end. And we haven't really done this before, but if you live in the greater Houston area, you will see billboards in all different places across the area promoting Prevent Blindness Texas. And that's super cool. And then, of course, we'll have social media and email, but the whole idea is to be the difference, that your support will be the difference for someone being able to see. So we hope this year you will be the difference for PBT. Get involved with us, support us, and help us make a difference for those we serve. Thank you so much for the year we've had and for all the exciting things that are continuing to happen for Prevent Blindness Texas. And always, if you want to get involved, please reach out. We are always happy to have people come to the organization and help us move our mission forward. Have a great year. Happy holidays. And thank you for supporting Prevent Blindness Texas. And we will see you after the new year on a new podcast. Thanks and take care.